Okay.
Alright. Tonight I'd like to discuss the argument of euthanasia brought forward by Brian. But first I'd like to start with a quote by Luke Gormley, the senior research fellow at the Linacre Center for Healthcare Ethics, who declared, "Society's prohibition for intentional killing is the cornerstone of law and social relationships. It protects each of us impartially, embodying the belief that we are all equal." The very heated debate over whether euthanasia is ethically wrong or right, has been getting rather hot as of late. There are some very strong cases for both sides of the argument. However, Brian's argument was neither strong nor accurate, and at best I would call some of the information he provided questionable. Brian's argument is problematic in two critical areas. First, some of the statistical information he provided was distorted in his favor and dishonestly used to deceive and mislead us. And second, he falsely presumes a similarity between animal euthanasia and human euthanasia. Let's begin with some of the problematic statistical information Brian used to support his claim. During his speech, Brian provided us with the following statement. A medical journal found that 80% of cancer patients in the Netherlands wanted to be euthanized. This shows that a bunch of people want it. I'm not sure what medical journal he found this information in, but he makes a hasty generalization when he assumes a bunch of people want the euthanasia option from the fact that 80% of cancer patients in the Netherlands wanted it. I found that in 2006, 83,000 cases of cancer were diagnosed in the Netherlands. According to this number in Brian's statement, around 66,000 people wanted to be euthanized. It is not correct to assume that a bunch of people want to be euthanized or want a euthanasia option because 66,000 people in the Netherlands wanted it. Furthermore, I find it hard to believe that 80% of all cancer patients in the Netherlands would rather just give up and die than seek treatment for their illnesses. Another claim Brian used to support his argument is that euthanasia will help reduce medical bills and save money. Brian used a report from the New England Medical Journal called "What Are the Potential Cost Savings from Legalizing Physician-Assisted Suicide?" He correctly quotes the article when he mentions that physician-assisted suicide could save an estimate of $627 million. However, he leaves out the very next statement that says this is less than 0.07% of the total health care expenditures. The article actually suggests that physician-assisted suicide is not likely to save substantial amounts of money in relative terms, or either for particular institutions or for the nation as a whole. In the introduction, the doctors who wrote it explain, although we do not agree with each other about the ethics or optimal social policy regarding physician-assisted suicide and euthanasia, we do agree that the claims of cost saving distort the debate. In other words, claims of cost savings should not be included as grounds for euthanasia option because they are unsubstantial. Now that I've discussed some of the problematic statistical information, let's move on to this analogy between animal euthanasia and human euthanasia. Brian provided us with a hypothetical situation in which people put down their animals because they're in substantial pain. He stated, "The situation these animals are in is no different than people with terminal illness are in. However, should we assume that a suffering animal is no different than a terminally ill person? I think the value of a human life is much more cherished than that of an animal. And I have a major problem in stating, or I see a major problem in stating that a suffering animal is the same as a terminally ill patient. Furthermore, just because we do something to an animal does not mean we should do this to ourselves. We use animals for experimental laboratory research. Brian's analogy was justifies using humans instead." In conclusion, Brian's major claim that euthanasia will reduce suffering in patients with terminal diseases is not really debatable. If you're dead, of course you're not suffering. You're dead and you can't suffer anymore. I believe he was trying to argue that euthanasia has some benefits for America. However, he did not provide us with accurate or truthful reasons to accept his claim. First, he provided statistical information that was problematic, incorrect, and taken out of context. It is ethically and morally wrong to take information and distort it to make it say something different than it was originally intended to say. Second, he made a false analogy between animal euthanasia and human euthanasia, in presuming that what we do to animals we should do to ourselves. To finish, I'd like to quote a piece of the Hippocratic Oath, the oath a doctor adopts when he or she starts practicing medicine, which states, "I will neither give a deadly drug to anybody if asked for it, nor will I make the suggestion to this effect." Thank you.
I like the clarity of your claim is very solid. I like the nice general quote that you have to start off talking about the subject. On the first point, you basically are challenging the way the information has been utilized, and I think that you've got a very good challenge on that. I'd be a little careful about the language that you use to suggest that Brian is automatically unethical because of the way he's used the information, but I think you could focus, for instance, on how the information doesn't support the conclusion, how it has been misrepresented, and how the actual opposite of what the conclusion was that the advocate came up with is the conclusion that the author intended. I think that if you lay that case out, people will make whatever inference they want about the speaker, and then you don't necessarily come across as being, harsh in your judgment in that situation. I do think, though, that you had a very legitimate point on that, especially when you quote the evidence in context, followed up with the next sentence, and explain how both sides generally seem to agree on that cost issue, for instance, that the information shouldn't be utilized for this decision, that it really involves other decisions. On the second point, you challenge the analogy, and I think you've got a good general challenge on the analogy. I think that there are stronger arguments to be made here. Basically, you just have the hypothetical on experimentation as the only point that's being made as a comparison, and I think there are probably some other elements of the analogy that could be challenged. I thought you had a very good summary. It's easy to follow your argument all the way through, so that is really nice. Very good. Thank you.